Hi again, my name is Tom Hills from Laudio, and welcome to part 2 in our series about reclaiming the fine art of listening well in healthcare. And leading the conversation and joining me today is Dr. Cynthia Clark. Cindy, again, has been a nurse for more than 35 years. She's the Strategic Nurse Advisor for ATI Nursing Education and a contributor to Laudio's frontline community. Cindy's Professor Emeritus, founder of Civility Matters, the author of Creating and Sustaining Civility in Nursing Education, and is an international expert in fostering civility and healthy work environments. So Cindy, again, it's so great to have you here with us.
Thank you very much, Tom. It's just a privilege. I'm so happy to be back.
So we're going to turn now to a second topic area here, which is about the importance of co-creating team norms. And the first question that I had for you is, why is consensus so important in the development of team norms?
Yeah, thank you. Thank you for a great question. So when I think about consensus or consensus building, when it comes to team norms, the word or the concept that immediately comes to mind for me is co-creation. In other words, having all members of the interprofessional healthcare team coming together to collaborate and have a conversation where they can share perspectives on what it would mean to create a civility charter with team norms. That charter would emphasize things like civility, collegiality, inclusion, belonging. So what we would do is, as a group, we would agree on a list of desired behaviors that support our teamwork and our productivity and our high performance.
Well, what are these team norms, and why are they so important to the interpersonal or professional team collaboration and the health of the organization and the health of the patients in terms of patient safety?
Yeah, perfect. To me, that's kind of the punchline, that having these kinds of organizing ways of thinking, behaving, and interacting only can contribute to the health of not only our organizations, ourselves individually, and certainly our patients and their families. So when we co-create norms as a team, what we're doing, as I mentioned before, is collaborating to come together to create what I like to often call a touchstone for desired behaviors. And it's a pledge that we make to one another, if you will, or a commitment to our coworkers. Sometimes teams will call them a social contract, or they'll call it a way of having rules of engagement or team norms, whatever we call it. The key is to set up these norms to serve as a guide for our interactions. So Ken Blanchard, who I'm pretty sure many of our viewers are familiar with, a leadership scholar, once said this: a river without banks is a pond. A river without banks is a pond. So similarly, I really believe that any team or organization without a charter and an agreed set of norms really is a rudderless ship. So when we're going to co-create and implement these team norms and really make this commitment, this process can be led by anybody on the team. It doesn't have to be the nurse manager or someone in a formal leadership position. It can be any of us who want to take on this responsibility. And I really cherish the responsibility when I've been asked to lead this discussion. So there's lots of ways to do it, but I'd like to give our viewers just a real quick way that I've adapted from the Center for Creative Leadership. So you have your team, and you might ask them, first of all, and they could write it down, or they could think it out, or they could work in, small little groups. But we want them to first think about this. What's the very worst team you've ever been on? And it can be a sports team, it can be a work team, it can be a church group, it can be a Boy Scout, it can be anything. what is the very worst team that you've ever been on? And then generate some conversation around what made it so unproductive, what made it so unpleasant. And then as you share those experiences, you're going to go into the next phase, which is, okay, now think of the most awesome team you've ever been on. What made it great? What made it a high-performing team? And then again, sharing what those behaviors or interactions were like that made it so great. And that can help us begin to generate literally a list of what those norms will be that we agree to. And that's the agreement that, you know, we make to one another, but we're also committing to abiding by this set of norms, as well as holding myself and my colleagues accountable for achieving those norms. So there's lots of different team norms. In healthcare, of course, way at the top of the hit parade, what we might see in a list of norms would be assuring our unequivocal commitment to patient safety, for example, that we are going to use direct and effective and respectful communication. And Tom, if you can go to the next slide, I thought I would share with you an example from Centra Health in Virginia that made a commitment to colleagues, and I just love them. So you see that this doesn't have to be an exhaustive list. And you see exceed expectations, lead by example. I won't read them all, but you see how strong these are. And one of the things that I really love about this, and why I selected this one as an example, is that we want to put verbs in front of what it is that we are committing to. So serve with compassion, not just compassion. So when we think about norms, they are truly, I believe, the foundation for creating healthy work environments and protecting patient safety. So thank you.
Thanks so much again, Cindy, on this very valuable section 2 of our series. We'll be covering now in our next episode, if you will, of this, leveraging a new framework for engaging in conflicted conversations. So look for that coming up. And again, Cindy, thanks so much for your time and your wise words today.
Absolutely my pleasure. Thank you very much.